Hello, I'm Dr. William Berger. I'm a board-certified internist, obesity medicine physician, and also a certified menopause practitioner via the Menopause Society. Today, I would like to talk to you a bit about some exciting new developments in the hormone replacement therapy space, in particular, the removal of black box warnings from estrogen and progesterone containing products. This is a new decision, and I think a very favorable one made by the FDA. Just a little bit of background as to why these warnings are being removed and what this means for women who are experiencing the vasomotor symptoms of menopause, such as hot flashes, night sweats, sleep disturbances, as well as the genitourinary syndrome of menopause. So the WHI, or Women's Health Initiative study, which was completed in 2002, generated some data using estrogen and progesterone products that are really no longer in use that was concerning for increased risk for cardiovascular disease, stroke, breast cancer, and possibly dementia in women treated with these products. But upon reevaluation of the data, and in particular the fact that the average age of patients in the WHI study was 63, there has been reevaluation of that, as well as looking at a lot of the data from the newer products that we tend to use. We don't use the conjugated equine estrogen product that was utilized in the WHI study any longer, and we also don't use the progesterone product called medroxyprogesterone acetate that was used in the WHI. So between those two things, the FDA has elected to remove the black box warning for those things, again, cardiovascular disease, stroke, breast cancer, and dementia, because it has been found that for women who are aged 50 to 59 or within 10 years of the onset of menopause, the risk for these things is exceedingly low. It's termed rare by the FDA. And therefore, it is appropriate for most patients, many women, in that age bracket or within that 10 years of menopause onset to be treated with estrogen and progesterone. The one warning that will remain on the packaging is the risk of endometrial cancer, but we know that that risk is really only incurred for women who are treated with estrogen only and still have an intact uterus. In other words, they haven't undergone a hysterectomy. If a progesterone is used with those patients, the risk for endometrial cancer goes back down to the background that it is for everybody. There's never no risk of that in the population, but if a progestin is utilized in combination with estrogen, we know that the risk essentially goes down to what it would be regardless. So this originally was being thought about for vaginal estrogen products because there's very little absorption in that. So for the genitourinary syndrome of menopause with dryness, irritation, recurrent urinary tract infection, pain with intercourse, etc., definitely appropriate, but now also with the additional looking over of the WHI data and a lot of the new data, also the black box warning being removed from oral and also transdermal estrogen products. The thinking in general is that transdermal, so that's the patch or a gel preparation, the risk for all of these things is also decreased. But also for the oral administration of both estrogen and progesterone. Of course, any patient who has a history of breast cancer, in particular estrogen receptor positive breast cancer, it should be an open discussion with the breast oncologist, not just with the patient's internist or gynecologist, with regard to the appropriateness of using any particular estrogen-containing product. But in general, the risk is very, very low, but definitely that conversation with oncology should be had. So I wanted to just take a few minutes to talk about this, talk about what it means, so patients are no longer going to be inappropriately frightened away from using their vaginal estrogen cream, but also transdermal or oral preparations. It should always be an individualized conversation with the patient's physicians, and that's being highlighted on all of the new packaging, that this really needs to be talked about in the context of the patient's age, how long since menopause, and their overall medical personal history as well as family history. So if this is something that you are interested in pursuing, you should certainly reach out to your medical practitioners with regarding this. Of course, everything that I provide in these videos is for educational purposes only. No doctor-patient relationship has been formed. And if you have particular questions or concerns about your health, you should definitely reach out to your medical professionals. If you'd be interested in how we here at Northeast Medical Practice, a concierge-style practice in Great Neck, New York, can help you optimize your health, please reach out to us in the office at 516-604-3418, online at northeastmedicalpractice.com, through our various social media channels, through which you're probably viewing us right now, our YouTube channel, as well as my LongevityMD podcast on Spotify, where I interview other physicians and also give talks about optimizing one's health and longevity. But until we see each other next time, be in good health.